Good evening and welcome to Prescription for Health. I'm your host, Dr. Joe Zerkowski with Baptist Internal Medicine Group, and I'm here with some very special guests. I'm sitting in this week for Dr. Grady Carter from First Coast Medical, and we have a very interesting topic this evening, and one that seems very simple but still a lot of confusion. I'm here with Michelle Smith and Patrick Wolf from Massage Heights. It's very interesting. We've talked a lot about massage and LMT and NMT. I know a lot of our listeners have heard about this, but we really want to get into the nitty-gritty of massage therapy today. Guys, thanks so much for coming in.
Thanks for having us.
Michelle, tell us a little bit about your background and how you got into massage, and then Patrick, if you would also.
It was basically something I never saw myself doing. I never thought about it, was never interested in, and then met a therapist and talked with him for a long time, knew him for a couple of years, and one day he said, you know, I really think this is something you should check out. I think this might be a lifestyle you'd be interested in. Looked into a little bit, and it sounded fantastic. I mean, helping people and having hands-on, doing something different every day, and really being able to see a physical change in people was something very, very interesting to me. Went to Kaiser Career College here in town, and graduated last year and got a job and loving life.
Good, good. Patrick, tell us about your experience.
Well, I've been an athlete most of my life, so I kind of been into the massage therapy field. I got into it actually through personal injury. I've had multiple breaks on my left ankle. I went through doctors, went through some PT, and then finally I went to a massage therapist. And with the tendons and ligaments in your ankle, you need a lot of circulation to heal quickly. So I went to a massage therapist, and they performed a lot of different spreads and actually helped to push a lot of circulation through there and helping the healing process.
Let's touch on that a little bit, guys. One of the things our listeners and questions I get every day in my office is, you know, how is massage going to help me? Dr. Joe, you've talked about going to a massage therapist and or a physical therapist, or maybe combined, or a massage therapist. How is that going to help me? Guys, tell our listeners and break it down very simple. How is massage going to help them? And then tell us exactly what it is. What do they expect when they come in your office and see you?
Well, the main thing that massage does for a lot of people is helps to relax the muscles, relieve stress from the muscles. A lot of people, everybody has stress. Everybody suffers from stress in their daily life, and with stress builds tension in muscles. And a lot of people, they say, you know, these are my stress areas. These are the areas where I hold all of my stress. So they come in, you know, we massage, we use different techniques to help relax the muscles, release the stress, release the toxins, and create a better, healthy feeling and life.
Right. A lot of people are still apprehensive about going to massage therapists. Explain to them exactly why it's very different now. There's no worry. It's very professional. It's very clean. I know especially Massage Heights is well known for really being a very professional, very sterile environment, clean environment. Talk about that a little bit, guys, if you would.
Well, when you're coming in for your massage experience, we have a clinical sheet that you actually sign in with. It's medical history. We want to know a background of what you have going on, and we also want to make sure it's cleared with your doctor before you get this. It's not just a fly-by-night, come in and get a massage. We want to have practical reasons and want some background when we're actually performing the massage. Our treatment rooms, we have 11 treatment rooms, and all of them are very adequately stocked, staffed. We actually have elevations and quality sheets, blankets, comforters, heated appropriately. We have a heated table, hydraulic lifts, so if you have any issues, we can lower the table down as far as you want or as high as you want as well. To expect in a massage, you really need to communicate with your therapist, because we have open ears and it will not offend us whatsoever. If you have a specific area that needs worked on, you need more treatment in, say, back, shoulders, or neck, just discuss that with your therapist, and you'll be able to actually receive a better massage that way, knowing what areas you want to focus on.
How often, let's say I have a whiplash. I come in, I've seen my doctor, I have a whiplash, my doctor wants to institute some massage or neuromuscular therapy. We'll talk about that on the second half, I think. But what should I communicate with you, Patrick, about I've had a whiplash, my neck hurts, I'm getting headaches. How would you use that information in coming up with a plan for that patient?
Well, with the information, I'd like timing. I'd like to know how long that you've had this and how often does it hurt on a scale, possibly from 1 to 10. Also, with whiplash or anything car-related, you really want to do some palpations as a therapist to feel out the different locations. If you have inflammation, you want to avoid that area. Working with any swelling in that area, you want to work locally, not generally in that area. Also, you want to talk to them about pain referral, and also talk about how much ice, elevation, even possibly heat therapy, we can work with that as well.
You know, talking about referred pain, Michelle, we were talking a little bit before we came on. It's a hard concept for a lot of patients to understand, particularly if my neck is bothering me, why am I getting headaches, and why is this referred pain down my arm, and why are my fingers tingling, or why is my toes hurting, you know, why is my... Talk a little bit about that. Explain to our listeners very succinctly and sort of simply, if you would, Michelle, about referred pain and how it's important to treat that and really go after that.
Referred pain is probably one of our biggest issues. Muscles are extremely tricky, and just because an area hurts doesn't mean that that's what's causing the pain. And it is a difficult concept to understand. It was a difficult concept for therapists in school to understand. But once you really understand the muscle and understand what their actions are and the things they create, then you really start to understand why it's possible for them to send pain to different areas. And we always say we don't chase the pain, we chase the problem. You tell me a certain area hurts, I want to know what you do for a living. Do you sit in a chair all day? Are you at a computer for hours on end? Are you consistently bending over? Are you picking heavy things up? That will help me know if that muscle, the area you're feeling the pain, if that's what's actually hurting, or if there may be another culprit sending the pain there. And so that helps us work better too.
Interesting. So what you're talking about, and we've had a lot of physicians and healthcare providers and chiropractors and surgeons and physical therapists, but you're really going through the same sort of mechanical assessment. What are the mechanics? What's the mechanism of injury? How can we look at this to get you acute relief, but keep it away.
Continue,
you know,
yeah.
keep it away. Talk about maintenance. A lot of my patients come in, guys, and talk about, should I be going to maintenance massage? What does that mean, maintenance massage, and how does that work?
Maintenance massage, basically, I mean, if you're looking more to just relax, if you're just, you know, trying to relieve your everyday stress, once to twice a month, okay, you're good. But I mean, if you really have chronic issues, if you're consistently having pain, if you can't do certain physical activities because of tension and pain, then I mean, you need to communicate with your therapist, and depending on the severity of the situation, you'll together create a maintenance schedule that you slowly taper down from, and then, you know, create just a once, twice a month kind of lifestyle.
Gotcha. You know, it's interesting, when I talk to patients about going to massage therapy, I'm very upfront about saying this is not like going on a cruise ship and getting a massage. Number one, it's going to hurt. And that's a hard thing for people to understand. Now, they understand if they have an acute injury, or if they've had a lot of body work, or if they've had deep tissue work before, that it's painful, but it builds on itself. And that's a little bit harder concept. How would you explain, Patrick, when you talk to clients or talk to patients about the massage actually builds on itself? And I use that quite a bit in my office.
Well, I have a lot of repeat clients that come to me once a week, twice a week, sometimes 2 times a week, depending on the severity. And with this building up, that we call it building the massage kind of tolerance, a lot of people are getting fresh into deep tissue work. It has a lot of different pains that can happen, but a lot of that sometimes is not enough water after the massage. Sometimes that's working too deep into that area. I always like to work firm to deep and then work into that situation with that. You always don't go in deep. Some people think as soon as they're going to get on the table that we're going to try to, manipulate or go in too deep too fast. A lot of times with deep tissue work, it's going to help relieve stress on those muscles, but they also don't understand that sometimes it's physical exercise that your muscles are receiving with a deep tissue massage. Sometimes we're working muscles that you don't work that much, or we're working muscles that have been strained, torn, or have any previous injury. So it's kind of a hit and miss with the deep tissue, but sometimes somebody's deep is different than others. So that's another big thing. Communication is very key. When you want to coming in for a deep tissue massage, you want to be vocal with your therapist so the therapist can actually help you instead of, quote, hurt you when you're on the table.
Right, because a lot of times it is painful, but they definitely get relief. And it's funny, I find in my practice, and we were talking earlier, I do a lot of, as a sports doctor, I do a lot of non-surgical orthopedics, soft tissue injury. I see fibromyalgia, a lot of back, neck injuries, and chronic sort of subacute pain. And I use massage therapy in my practice as much as I do physical therapy. And I like to combine them. I get the best results when I combine physical and massage therapy. And so I typically only send to places that have massage therapists in the physical therapy center. But as a side note, let me bring up another topic. And I've been very interested in this, and we're really seeing a lot of this being instituted in the sports field. Are you guys familiar with the Grafton techniques or any techniques that works fascial planes? There's a couple of new techniques that we're using in the sports arena, mainly in athletic trainers and athletic training rooms, where it's a scraping of the fascial planes, deep tissue fascial planes. Now, I'm not very familiar with it. I don't know if you guys are, but it's becoming more and more popular, and it actually scrapes the skin, and it's supposedly working the fascial planes, rotator cuff, neck, back, and I think we're going to be seeing a lot more of this technique utilized in massage therapy. I firmly believe you're going to be seeing massage therapists hired in doctors' offices within the next year or two. I think that's where this is going, guys. Comment on that a little bit. Typically, it's been to massage therapy centers that people are going. Now we're seeing physicians, of course, chiropractors have hired massage therapists for years, but MDs are starting to, we're utilizing more massage in our offices. Comment a little bit on where you see massage therapy going.
I know personally that I completely agree. I mean, it's growing insanely and so quickly. And like you said, I mean, chiropractors have worked with therapists for years and years, but it's becoming, I remember going to the chiropractor and I never heard of massage therapists being there, and now it's almost as if every chiropractor you see is, if they haven't had a therapist on staff for years, they have just hired one or they're going to hire one, and it's, I mean, that alone is saying tons. And like you said, a lot of doctors' offices have started to bring in, and it's not just for, the
feel-good sort of massages. Yeah, we're not talking about that
everybody's starting to understand the health benefits and the actual physical and mental changes that massage creates.
That's very interesting. As you said, the mental changes. I do believe there's a well, we know, it's not that I believe, it's been clearly shown, the neurochemical response to hands-on touching and massage, as opposed as and with the localized blood flow, cytokine release, that types of things. It's much more sort of comprehensive than just putting your hands on someone and rubbing an area of soft tissue. Talk a little bit about what, do you guys specialize in different areas, Michelle or Patrick? Do you have, I know massage therapists actually sort of specialize. They have sort of head and neck massage therapists and specialized neuromuscular therapists. Explain to that a little bit from our listeners. If they go in and they, well, you're a neuromuscular therapist, what's the difference between a licensed massage therapist?
Well, in the massage therapy world, we call them modalities. It's different areas that we actually specifically go into. Personally, I do AIS, which is activated isolated stretching. MIT, which is myofascial integrated technique. That's a stretching technique and a deep tissue release. It's actually release in myofascial. But a lot of us have very diverse backgrounds. That's why you want to talk to your therapist to find a therapist right for you, because I work with a lot of athletes. I do a lot of sports massage, but I also do specific deep tissue work. A lot of people have a lot of migraine issues these days with occipital ridge pressure, different nerve pains. I work with craniosacral therapy, which is a pressure point therapy that actually helps release tension in the synovial fluids in the body, but also relieves tension from nerve pain. So there's also a lot of...
Michelle, do you have a special area?
I've been trained in bits of neuromuscular. I'm not certified completely in neuromuscular yet. I am a new therapist, so my continued education courses are well on their way. But I'm extremely interested into reflexology. That's probably going to be one of my first. Just relieving pain in pressure points in the hands, the feet, the ears, different areas where you've got specifics. It's super interesting to me to see the changes you can create in someone's body just from those specific pressure points. It's
interesting that you say that. One of the things that I've been interested also, as opposed to the scraping techniques, is active release techniques. Now, active release techniques is, in my mind, is really nothing new. There's a lot of people sort of marketing it now, but it's really an old technique in releasing, as you said, Patrick, the myofascial and the fascial planes. Comment on that a little bit, because that's gotten a lot more press recently, these sort of techniques of active release. I see chiropractors doing it, massage therapy, and actually physicians. I'm starting to incorporate some in my office too. Talk about that a little bit.
There's a couple different ways to go about that. A lot of therapists use trigger point therapy to hit on those areas that are doing a release, but there's also a vast amount of therapists that are actually getting into acupressure instead of acupuncture, actually hitting acupressure points. And that's a little different style of massage, because you're actually hitting on areas that work with that referred pain that we talked about earlier. A lot of holds and a lot of heavy pressure, but it's also with positioning as well. There's a lot of positioning.
Through a range of motion of the joint.
Range of motions, joint manipulation, and working with that with actually some deep tissue work as well to break down the myofascial plane. The shoulders, ankles, knees, a lot of things like that. A lot of joint manipulation is a big issue with that.
It's really interesting. And see what you guys think. Over the last, I'd say 10 years in being a sports guy in town here, I've seen a sort of accumulation of techniques from a lot of different types of providers. For example, we have MDs doing massage. I do trigger pressure and trigger point injections in my office. We see neuromuscular therapists and licensed massage therapists doing mobilization. We see chiropractors doing mobilization. Physical therapists now are doing a lot of soft tissue work. What's your feel about this? Do you think the sort of the discipline of soft tissue work and activated release techniques and mobilization of joints is sort of all, a lot of people are sort of doing very similar type work? What's your feel about that?
I mean, I definitely, it's skeletal and muscular, they go hand in hand, so I mean, it's necessity for it to be done in so many different areas. I mean, it's different fields. Like I said, it goes hand in hand. You can't have one without the other.
It's interesting. I want to make a comment. Many times, when I do trigger point injections in my office, and working with a massage therapist, I'll have the massage therapist mark the points that they can't release. And that's where I put the trigger points. Tremendous, tremendous result with trigger point injections and neuromuscular therapy or licensed massage therapy combined. When I release the trigger point, and then all of a sudden, 2 or 3 days later, they're seeing massage therapists are getting much. That's when I see the tremendous amount of improvement.
Definitely.
Functionally, they're sleeping better, they can sit at their desk, they're able to go to work. And sometimes just that combination, they'll actually mark an X on the spot that they just can't release, you know, that's right,
Sometimes they fight.
It's a very good point with marking the trigger points to help with release. The soft tissue manipulation that you're talking about that's kind of spreading through all the areas, the trigger point therapy, like I said, is a little different, but working hand in hand with somebody like you that's in the sports therapy background, massage can release as much or as little as that person wants, because sometimes it's physically them holding back.
Right.
And it's just the emotional release you can get from massage as well, with just relaxing enough to relieve some of that everyday pain, because some people are working with this chronic pain that they've just adjusted to their whole life. And once you get, you know, kind of some hands-on work with them, they have the ability to relax, and then working, like I said, hand in hand with different either physical therapists or doctors as well, it's kind of puts into consideration what can't we do, you know what I mean?
Let's go back a little bit. We really jumped ahead, and I know I've really put you guys on the spot a little bit on some of the questions, but let's go back, talk about some very basic types of massage, because we hear about sports massage and Swedish massage, and what I call cruise ship massage. I don't know what that means. And we've been talking about the therapeutic end of massage, of course, very in depth, but there's also massage for relaxation. But someone doesn't have to be injured to come in and see a massage therapist. Talk about that, the different types of non-sort of therapy. It's all therapeutic, I guess. Talk about that a little bit, if you would.
Well, the two main styles of massage that most people hear most commonly would be Swedish massage and deep tissue massage. Swedish massage is kind of just the baseline for most therapists. I mean, the strokes and techniques used in Swedish generally follow in different styles and techniques. They're long, they're flowing, they're continuous, they're broad. You're basically just relaxing the outer muscular. I mean, it's basically just broad, flat, nice, easy, relaxing.
Massage,
yeah. And then deep tissue is going to be more of the not necessarily neuromuscular. Those two generally get thrown around a lot together. But the deep tissue is deeper pressure, more localized pressure, more specific areas being worked. That's when we really get in and we feel the areas of tension and focus on those and go for it. So those are the basic two.
Patrick, did you want to comment on that a little bit, what your mind is?
Yeah, some people think deep tissue is just applying pressure, the applied pressure. Most deep tissue massage is separating musculature, actually working on attachments, but not just the body of the muscle. With the Swedish, you're working to relax, which is fantastic because it releases endorphins and actually lets the body kind of come to rest. With the deep tissue, some people think that it's just pressing down deeply on them. It's more specific work. It goes into the trigger point therapy as well, working into the specific regions that need to be worked on. But the deep tissue is definitely a heavier pressure, and it's not a farce that guys and girls are different. Girls can apply roughly as much pressure as the guys can. It's all about technique and positioning. So
let's talk about the economics a little bit about massage. Still very confusing to clients and patients of mine. Many times massage can be picked up by insurance, and there's certain instances where it is, and most times it's not picked up by insurance. And correct me if I'm wrong, this is my understanding, that patients will have to pay out of their pocket. Talk a little bit about the economics, guys. How does it work with, you could even talk about massage heights. Do you bill insurance? Is there an opportunity for patients to pay for like memberships? They can get multiple massages if they're, and I hear it's becoming very reasonable. Talk a little bit about that if you would.
Well, we've massage heights, personally, we don't do billing for insurance, but we can give notes and receipts for insurance claims and whatnot.
For health risk, HSAs now. So I think they're picked up on health savings accounts. You can give them a super bill that they can send into their insurance company for reimbursement under their health savings accounts.
As far as I know, yeah.
As well as I actually have a client that I work with that is for tax purposes as well, because of the multiple massages. And we at Massage Heights, we will give you the paperwork that you need to take to your insurance company and things like that, but we do not do direct billing with the insurance company. There's a lot of places that do, but there's also, if you're documented and send these into your insurance company, they'll actually work with you on that.
Yeah.
And there's
That's
also
good.
talk of people using their flex cards now.
Right.
I don't know exactly how that works, but I know I have heard things about people coming in and using that.
Right.
And so, I mean, that's another way to get into.
With using your health savings accounts that
Mm-hmm.
you put your tax-free money away to be able to use that. And it's very affordable. I mean, it used to be fairly expensive from what, I mean, 10 years ago, but now it's much more affordable. And, you know, I know a lot of patients of mine have questions about how many times a week, and I'm not going to be able to afford that. But you can work with clients and people about memberships. Is that correct? Don't you have memberships sort of at your explain how the memberships work.
Well, we have 3 levels of membership. We have the Foundation, the Heightened, and the Pinnacle. And these are set at different levels. It's $49, $59, and $79. And with these, it's given a 1-hour massage per month, but you're also set in at the member rate. So you can come in at any time and get as many massages as you want at that set member rate. Some people think that it's going to be a little too expensive, but when you think about it, a visit to the massage therapist and the way you feel after you leave there, the money's kind of, it's the proof's in the pudding. When you feel better leaving a massage, you don't really worry too much about that, you know, say $50 an appointment. Comparatively, like you said, 10 years ago, you couldn't find a massage for $50 a month. At Massage Heights, we try to provide a affordable way to come in and actually, you know, relieve stress and specifically work on people with muscle tension. So
Let's talk about post-massage a little bit. We have a few more minutes. Talk about what patients should expect after a massage and what should they be doing. Now, I know whenever there's pressure on muscles, there's breakdown of byproducts and cytokines and creatinine kinase. Talk about that a little bit from the muscle end, physiologic end, and also what they should be doing practically.
After a massage, most people are going to experience a little bit of a slowing down. I mean, you've been laying down on a table for roughly an hour, sometimes longer, sometimes a little less. You've had all of these toxins and lactic acids pushed through your body. So, I mean, you're gonna feel a little bit of a decrease in energy, but you leave your session, you drink tons and tons of water, you do lots of stretching to continue getting everything pushed through your body, and you know, within a little while and even into the following days, your energy picks up, your mental attitude picks up, your physical feeling of well-being is dramatically and drastically increased.
Mm-hmm, mm-hmm. Should I take I mean, one of the things, a lot of patients do take anti-inflammatories after a massage therapy session because sometimes it is painful. I've tried to discourage patients from doing that, but sometimes you know, they'll ask and I'll say, well, if you're that stiff, you need to take a little something. Everybody's a little bit different.
Yeah.
And I think sometimes until you really get in sync with your massage therapist, talk, as you said, Michelle, discussing, communicating what hurts, what's making you feel better, what's allowing you to sleep, what are your mechanics. I think the communication might be almost as important as the massage sometimes because you're really focusing in on what the client needs, what the benefits are, how often you should see them. And normally, from what I understand, you shouldn't be getting massage more than twice a week if it's deep tissue. 2 to 3 times a week maybe? Is that what they should be expecting?
I would say, you know, depending on the severity of a situation, I mean, you know, 2 to 3 times a month would be okay. Mm-hmm. I know I've heard of clients coming in 2 times a week, 2 to 3 times a week, but I mean, I think that all just depends on...
That would mainly be for injury, though,
right.
The post-injury session. Yeah, okay, good. And so you should drink water, talk to your doctor about anti-inflammatories after a massage session, because that's a little risky, especially if someone has kidney failure or heart hypertension or something like that. But guys, I really want to thank you for coming in today. We've talked a lot, but if some of my viewers or patients or clients want to get in touch with you, what's the best way to get in touch with both of you?
Well, massageheights.com. Best way to log on to our website, check things out. You can review everything we've talked about today, talking about what you can expect during a massage, what's going to happen, talking about communicating with your therapist.
Good. And do you want to leave a phone number for our listeners, just in case?
Our location for the St. John's Town Center is 400-7777, or 800-400-7777.
Okay.
A lot of sevens.
I want to thank you so much for coming. I want to thank you. Thanks so much for being with us, Prescription for Health. We look forward to seeing you next week.